That's Gilbert. He is a professor at the Clinic of Emergency Medicine at the University Hospital of North Norway and joins me now live from Tromsø in Norway. Thank you so much, Professor, for being with us on the program. So the UN, of course, saying there that Israel is using starvation as a weapon of war, documenting children who have died from malnutrition, all while under a relentless bombing campaign. Talk to us about the long-term impacts that this will have on the population in Gaza and why Israel is particularly using starvation as a weapon of war.
Well, first of all, I think it's important to repeat that the use of starvation is criminal. You are not allowed to use starvation, lack of food, lack of water, as a war tool. And in particular, in Gaza, this also constitutes a form of collective punishment. So this is completely illegal and constitutes a war crime. The situation in Gaza has been reported repeatedly by the international organs who look after the nutritional status, the IPC, and it has been documented again and again that the lack of food and the lack of drinkable water in Gaza constitutes a major threat to public health and to the lives of the people of Gaza, in particular the most vulnerable, who will be the children, the lactating women, the women who are pregnant, the elderly, and of course, those people who are already sick, like diabetic patients and the wounded. So this is a long-term warning that finally now comes with a new warning, and it is all man-made. It's not the result of a famine or a drought or an earthquake or a landslide. This is all meant to be. And as you asked me, I think it is abhorrent that the State of Israel and the occupation army is allowed to perpetrate this massive crime against the people of Gaza. And the numbers are clear. If you look at the last flash report from UN OCHA, they actually say that more than 50,000 Palestinian children in Gaza will need treatment for acute malnutrition. Mm-hmm. Now, why is that an important number? Because 50,000 children, it's a massive number. Imagine if it was 50,000 Jewish children in Tel Aviv or in Israel. So these children are already needing medical support because they are malnourished, they are at the brink of very dangerous starvation, and they need micronutrition supply. Mm-hmm. Probably also need, many of them, IV treatment to reestablish both the protein balance and the fluid balance. But as we all know, the hospital services and the primary healthcare system in Gaza has been systematically destroyed by the Israeli occupation army. So where should they go, these 50,000 children?
Well, there have been calls for the entry of more aid and medical supplies, for that matter, into Gaza, including from Israel's strongest ally, from the United States. What's your message to U.S. officials that on one end are making calls to allow for the aid in, but on the other hand are aiding Israel's war on Gaza?
Well, it's a humongous double moral. It's a double standard. It's they're talking with two tongues all the time. It would never have been allowed to be used against the people of Ukraine. Then the NATO, the European governments, and the US would have forced opening on humanitarian supply. So what Mr. Biden and Mr. Blinken have to do immediately is to force the opening of multiple entries into Gaza for the free flow of humanitarian relief under UN control. And if that needs military presence from UN peacekeeping forces, then we need that immediately. Because if we do not open Gaza now for the flow of not only food and water, but also fuel for the hospitals, medical supplies, antibiotics, and IV fluids, we will actually face a warned mass starvation in Gaza, and more children will die. So this is a moral obligation, and the United States, of course, are completely complicit in the current mass starvation in Gaza. The Israelis are stepping up again the attacks, not only on the civilian population like in Gaza City and in the north, but also on the hospitals, forced evacuation of the Gaza European and also of El Ahli Arab in the north. It's a massive disaster that needs to stop immediately.
Indeed, there are those reports of hospitals in Gaza being systematically targeted. Dr. Mads Gilbert, thank you so much for being with us here on the NewsHour and sharing that insight with us. I appreciate it.